The huge cost of healthcare in Kenya has driven many into early graves, as majority of Kenyans cannot afford the huge piles of hospital bills, chronic illnesses, among them kidney failure. According to the World Health Organization, there has been a growing burden attributed to challenges of accessing quality healthcare.
2.1% of the total deaths.
Nominated Senator Isaac Mwaura, supporting a petition to have NHIF cover such illnesses, decried the fact that some patients miss proper follow-up, citing high cost of treatment, as with many succumbing to the illnesses.
That many patients opt to stay at dialysis stage than go get transplanted because NHIF does not support post-transplant medication, which ranges from 40,000 to 60,000 per month, Mr. Speaker.
Universal Health Coverage Program, whose pilot phase was launched in December 2018 by President Uhuru Kenyatta, was intended to ensure all Kenyans have access to an all-inclusive package of palliative healthcare services in the country. In line with the Big Four agenda, senators alleged that the motion has taken way too long to be addressed, asking the Senate to intervene in seeing that patients get the proper medical covers.
Actually support this important petition.
Supporting the motion, nominated Senator Gertrude Musuruve stated the need for Kenyans to access universal healthcare, as dialysis for kidney patients, among other chronic diseases, are not currently covered.
So many families are suffering out there because sometimes you'll find that the head of the family is supposed to actually look for money for dialysis, and he is not covered. So there's need to ensure that the NHIF covers dialysis patients so that these families are cushioned.
Meru Senator Linturi Mithika affirmed the necessity of the process of treatment in Kenyan hospitals, citing an incoherent plan in taking care of patients with chronic illnesses.
Even after treatment, patients are being forced to stay in hospitals. In the hospitals, awaiting payment from NHIF because they are sent or appear to not have enough sufficient money to guarantee claims that are being forwarded to them by hospitals.
In line with the same, Kisii Senator Sam Ongeri stated that the cost of dialysis in the country is the biggest challenge for patients with chronic illnesses, not just in Kenya, but globally.
If there is any intervention, and then through the dialysis that is being now provided by level 4 hospitals in each county, and including some of those in level 5, can only be sustained if there is regular dialysis. The cost of dialysis is very expensive.
The senators maintained the cost of dialysis in low and middle-income countries has not been keenly reviewed, thus exposing them to other infections.